everyone. Today we're going to be talking about Sinemet. You may be wondering, what is Sinemet? Well, it's a drug that's used to treat the symptoms of Parkinson's disease. It's a combination of two drugs, Carbidopa and Levodopa, and together these drugs work together to help increase the amounts of dopamine in the brain, which thus helps treat the symptoms, as the symptoms are caused by a decrease in dopamine. Together, the medications are more effective than they were individually, which is kind of how this drug came about. It can also be used to treat restless leg syndrome, which is an interesting tidbit. So, how it might help is, as I said, it reduces and helps manage the symptoms of Parkinson's. So, things such as muscle stiffness, tremors, spasms, the poor muscle control, and it might also help with the slowness of movements that are seen in Parkinson's disease. This is a picture of the pill. There are other options, which we're going to go over here to dosing. So not all of them look exactly like this, but this is a general idea. So it's taken by mouth. So that is, it's either a capsule or a tablet. There are some options for liquid suspensions, but that depends on the pharmacy and it's not often prescribed. There are also options for dissolvable tablets, depending on your needs and your pharmacy. So usually when people start this drug, they start by taking one pill 3 to 4 times a day. Then your doctor will work with you individually to assess your needs and make it fit for you. So if you miss a dose and it's close to the time that you missed the dose, go ahead and take the pill. However, if it's close to the next scheduled dose, you're going to want to just skip the dose and continue with your normal scheduled medication regime. Do not double your doses. Don't do that. Not a good idea. Some of the side effects that may be experienced include loss of appetite, nausea, other GI upset, increased sexual interest, behavioral changes such as an increased interest in gambling, very specific and interesting, confusion or drowsiness, twitching, twisting, and uncontrolled repetitive movements of the face, arms, legs, tongue, that might be seen as well. Seizures can also occur. So, things you're going to want to know are some of the interactions. Sinemet interacts with a lot of other drugs, so you're going to want to sit down with your doctor and go through a list of everything that you're taking, including over-the-counter drugs, so anything you're just going to buy at the pharmacy, including anything you might take for a headache or a cough. You're going to want to talk about those as well, even if you just take them once in a while. And Sinemet can also interact with high-protein diets, so for people taking this drug, we want to steer towards low protein because the protein can get in the way of this medication's effect. It also interacts with several disorders and diseases, so do not take this drug if you have a history of narrow angle glaucoma, melanoma, or reactive airway disease like pneumonia. Not pneumonia. I meant to say asthma. Yes. So when you should talk to your doctor, of course, it's when you start taking it. You're going to want to go over all the drugs. Don't start taking anything without talking to your doctor. And you're going to want to regularly see your provider or doctor, depending on when you're taking this drug, because there are certain levels that they'll want you to be within. And just to assess how you're doing. Yes, and also, if you're experiencing any of these side effects, or if you're noticing changes in behavior or excessive drowsiness, you're going to want to call your provider immediately. So, there you go.